doing it right.
Oh,
So
thanks. Thanks. I'm still recording.
You're not doing what you learned. So. You're welcome.
Okay. Hello. All right. Can we start over? Sorry.
We're good. No, go right now.
All right. Hello, representatives of our great state of South Carolina. I'm here to talk to you on behalf of the FDA about a drug called Neurontin, which is sold under the generic name of gabapentin. It is an anti-epileptic drug or an anticonvulsant. It is also commonly used to treat nerve pain caused by herpes or shingles. It can be used to treat diabetic neuropathy, peripheral neuropathy, trigeminal neuralgia, and restless leg syndrome. Today I would like to inform you more about this drug and why I believe that it should become a Schedule V controlled substance to help prevent statewide peddling and recreational use. Before I explain why I think gabapentin should be a scheduled drug, I should explain what drug schedules are. In 1970, Congress passed the Controlled Substance Act. This law established the Drug Enforcement Agency. This law also categorized substances which were controlled at the time, approximately 160 drugs, into schedules from 1 to 5. Schedule I drugs have no currently accepted medical use in the U.S. A lack of accepted safety for use under medical supervision, and a high potential for abuse, meaning that it is a highly addictive type of drug. Some examples are heroin, ecstasy, and LSD. Schedule II drugs also have a high potential for abuse, which may lead to severe dependence, physiologically and physically, but still have a medical use. Examples are morphine, methadone, Percocet, fentanyl, Ritalin, and Adderall. Schedule III have a potential for abuse less than substances in Schedule I or II, but abuse may lead to moderate or low physical dependence, or high psychological dependence. Examples include testosterone and Suboxones. Schedule IV drugs have low potential for abuse relative to substances in Schedule III. These include benzos and soma and other drugs. Substances in Schedule V have low potential for abuse relative to substances listed in Schedule IV, but consist primarily of preparations containing limited quantities of certain narcotics. This is the schedule in which I believe gabapentin should be in. Before I can explain why I believe gabapentin should be a controlled substance, I'd like to explain how gabapentin works and what it's used for. The way in which gabapentin works is not fully understood, but it is thought to work by binding to calcium channels found on nerve cells in the brain and spinal cord. This is thought to affect the release of various neurotransmitters from these cells. Neurotransmitters are natural body chemicals that are stored in these nerve cells. They're involved in transmitting messages between the nerve cells, and gabapentin is thought to reduce the release of one of these neurotransmitters called glutamate. Glutamate is a neurotransmitter that acts as a natural nerve exciting agent. It is released when electrical signals build up in nerve cells and subsequently excites more nerve cells. It is thought to play a key role in causing epileptic seizures. In reducing the release of glutamate from the nerve cells in the brain is thought to help stabilize the electrical activity in the brain and prevent epileptic fits. Side effects of gabapentin include seizures, bipolar disorder, pain. People may also experience depression, suicidal thoughts, and other mental mood disorders. Other side effects include drowsiness, dizziness, loss of coordination, tiredness, blurred double vision, unusual eye movements, and shaking and tremors. There have been many reports that have shown that gabapentin has potential for abuse and can be slightly addictive. And I'd like to share some of these reports. In 2004, a report claimed that gabapentin misuse was present in correctional facilities in Florida. 5 inmates reported they were inhaling the powder from gabapentin capsules intranasally. All 5 inmates had psychiatric or pain diagnoses, as well as histories of cocaine abuse. 4 of the 5 inmates reported obtaining an altered mental state or a high similar to that from cocaine. Gabapentin was removed from the penitentiary formulary and prescribing was restricted to exceptional cases. In a 2007 report, there was a case describing a 67-year-old woman with mood disorders and a history of alcohol abuse who was prescribed gabapentin for pain from polyneuritis. Since she was tolerant, she was prescribed more than the recommended dose, but used more than what her physician prescribed. She requested gabapentin without prescriptions from physicians and visited numerous physicians, exaggerating her symptoms to obtain desired quantities. This showed signs of dependence and misuse. When the patient was finally no longer able to obtain gabapentin, she developed withdrawal symptoms characterized by trembling, sweating, excitation, pallor, and exophthalmia. The withdrawal required hospitalization, where a change to alternative pain control medications was made. Within several months, this patient had resumed abuse of gabapentin. Another reason why I believe gabapentin should be controlled is because it is very similar to Lyrica. Lyrica is already a Schedule 5 substance, and as you see here, it has similar structure to Lyrica. Lyrica is also used as an anti-epileptic for diabetic neuropathy, just like gabapentin. Pregabalin's mechanism of action is basically the same as gabapentin. And like gabapentin, pregabalin binds to the same subunit that of the voltage-dependent calcium channel in the central nervous system. It makes sense that if Lyrica has been proven to show abuse potential and misuse, then gabapentin should too, since they both have the same uses and have the same mechanism and effect on the body. According to another report, the use of non-prescribed gabapentin by patients attending substance abuse clinics have been shown. A questionnaire-based survey completed by 129 respondents attending 6 substance abuse treatment clinics found that 22% of patients admitted to using non-prescribed gabapentin. Only 3% admitted they have been abusing non-prescription Lyrica. This supports that because Lyrica is a controlled substance, it is much harder to obtain. And although Lyrica is a brand name drug and is much more expensive than gabapentin, it further supports that making gabapentin a scheduled drug can also increase its price. As of now, gabapentin is sold for $4 for 30 capsules. All right. Okay. Many people use it and ask for. Many people have been shown to ask for early refills, which is also evident that people are misusing it, or even maybe selling it. If it becomes a controlled substance, the price will rise and be sold less frequently. Therefore, many abusers will be deterred from using it. I believe strongly that gabapentin needs to be controlled before it becomes sold and abused recreationally in our state, widely in our state. Reports have shown that people admit to becoming dependent on the drug, and they have experienced withdrawal symptoms. And because it's cheaper than Lyrica, which is also controlled, it is most likely to be sold and used illegally. I have first-handedly seen its abuse potential, and it is time for you, the South Carolina House of Representatives, to pass this law and make gabapentin a controlled substance before it can do unrepairable damage. Thank you. I shouldn't have done that, but sorry.